Well, for the first time ever, a study by the IU School of Medicine is showing that children under the age of 10 can be asymptomatic carriers of the virus. Fox 59's Russ McQuaid has more.
In April, IU medical students fanned out in Indianapolis, testing the community at large to determine the prevalence of the COVID-19 virus in places where doctors weren't looking, which was anywhere that wasn't a hospital or a physician's office.
Only 1 of 511 people was infected, so it was a very low rate of infection. In this case, we saw a kid with a pretty high viral load that didn't spread, but I wouldn't be falsely calmed by that because I think we need 10 or 15 or 20 kids to know the risk of infection.
That one asymptomatic carrier was a child under the age of 10, and that surprised researchers, especially since all the other studies only look at adults or people who are already showing symptoms of the infection.
Asymptomatic infection is fairly low. So that probably tells us that the lockdown and the mitigation strategies we started early were probably effective, or at least helped to curb that somewhat.
Good news, that community spread isn't as prevalent as we all feared, and good news for parents worried about sending their children to school.
I guess the message to parents is continue to be cautious. I think that the number of asymptomatic infection or people with infection is not sky high. So I think that when we take a general look at the risk benefit of kids going to school, getting on school buses, the benefit probably does outweigh the risk as long as the rates remain low. When we're playing, maybe let's play outside more and let's try to play games or ride bikes or do things differently than we did before, where we don't necessarily have to be super close to a whole number of people.
In that one case, no one else in the child's family came down with the disease 3 weeks later. But pediatricians say they want to see more intensive studies of schools where there is an infection to see if it spreads. Russ McQuaid, Fox 59 News.
Now, doctors also tell us that when children do come in contact with the infection, they don't develop the severity of symptoms that adults do.